Mia, are we ready to begin?
Yes, we're ready when
Okay.
you're ready.
Okay, great. We will call the Ramsey County Board of Commissioners Board to order. It is January 11th, 2022. We'll start with the roll call, please.
Carter,
Here.
Bradham,
Here.
McDonough,
Here.
McGuire,
Here.
Ortega,
Aye.
Reinhardt,
Here.
and Matas Castillo.
Here. And we'll start with the Pledge of Allegiance led by Commissioner McGuire while we all go on mute.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. We have the agenda before you. Is there a motion to approve the agenda?
So moved. Second.
Thank you. Any discussion? Roll call, please.
McGuire,
Aye.
Ortega,
Aye.
Reinhardt,
Aye.
Carter,
Aye.
Bradham,
Aye.
McDonough,
Aye.
and Matas Castillo.
Aye. We have the minutes from January 4th presented for approval.
So moved.
So moved. Second.
Thank you. Any discussion? Right, roll call, please.
McGuire,
Aye.
Ortega,
Aye.
Reinhardt,
Aye.
Carter,
Aye.
Bradham,
Aye.
McDonough,
Aye.
and Matas Castillo.
Aye. And we have a proclamation for Healthcare Month. Commissioner Ortega, I'll let you lead the proclamation.
Thank you, Madam Chair. Well, I guess I was going to say have people come up, but we're not in, we're not in the council room. Whereas healthcare is a critically important industry, crucial to not only the health and well-being of Minnesotans, but also the strength of Minnesota's economy. And whereas healthcare workers have been on the front lines of COVID-19 pandemic for many months, enduring long hours and stressful conditions, saving countless lives, they deserve to be celebrated for their dedication. Whereas there are 387,500 people employed in healthcare roles in Minnesota, and as many as 7,045 healthcare professionals currently unemployed in our state, with projected high long-term demand for healthcare workers, and currently crisis level demand for many healthcare workers, from entry level to highly specialized. And whereas there are 35,932 healthcare professionals working in Ramsey County, including 743 dedicated Ramsey County employees who work tirelessly to provide quality care for our residents and to make our community healthier and safer. And whereas it is critically important to raise awareness about the many employment opportunities in healthcare, including those in hospitals and clinics, in senior care or other long-term care settings, and in direct support positions assisting people with disabilities in their homes and communities. And call on Minnesotans who want to make a difference in the lives of others to join or rejoin the healthcare field. And whereas healthcare offers many entry-level jobs that leverage transferable skills earned in other occupations, people with no healthcare experience or post-secondary education can work with many employers who provide on-the-job training, helping people get on track quickly for future career growth in the healthcare field. And whereas Today, young people need to be encouraged to explore the wide range of healthcare career options with great opportunity for growth to ensure a strong workforce in this essential field. Let it therefore be proclaimed that Ramsey County Commissioners designate the month as January as Healthcare Month. My computer just went out, but I think I got to the end of it. You know, that was a very lengthy and wordy proclamation, but I think it suffices that we know at Ramsey County all the good work that our frontline folks have made. I mean, they were really, when we say frontline, they were the front line. They're the ones that really engage our folks and really, you know, make the difference. They were the face of Ramsey County for almost 2 years, and we got to pay them a great gratitude for all their good work, and you know, and quite frankly, they made the difference. So I just want to say thank you to all our folks and all the professionals, not just in Ramsey County, but in the hospitals and so forth, for all the good work that they've made. Thank you.
Thank you, Commissioner Ortega. And I think we have some guests here with us as well. I know it's also a big time for talking about healthcare workers. And so I see Ling Becker, and then I'll call on commissioners for comments. So Ling, go ahead.
Yeah, thank you, commissioners, Madam Chair. Thank you for the opportunity to share about the healthcare industry with you this morning. It is truly a critical time to continue to have this conversation. So with me today, and I know Sarah Holly will have some comments as well, but I have with me Commissioner Steve Grove with the Minnesota Department of Employment and Economic Development. And I'd like for him to make a few remarks. Also, Laura Beath, who is the Vice President of Talent Acquisition for mHealth Fairview, and she's also the chair of the Governor's Workforce Board, so she can say a few words after Commissioner Grove. We also have with us Tanya Velicek, who is on our Workforce Board and is the Talent Acquisition Manager for Workforce Pathways at Fairview. And lastly, I want to have Archeon Mills share with you very briefly. She is a program participant with Ramsey County, and I know Commissioner McDonough, you joined us in a celebration last week, and Archeon just completed her CNA training. And so I'd love for you to be able to hear from a resident about their experiences in entering the healthcare field at this time. So if it's all right, I might turn it over to Commissioner Grove.
Yes, welcome, Commissioner Grove. We're glad to have you here with us today.
Hi, Trista. Hi, Commissioners. Hi, Ling. Hi, Laura. It's good to see you all this morning. Thanks for having me. It's an honor to get to join you today. And I just got to say, we are so thrilled to see the leadership of Ramsey County in declaring this healthcare month alongside Governor Walz. This is a critical time to highlight what is really a crisis in our state's economy right now. We are facing historic healthcare shortages. I'm glad Commissioner Ortega began by a word of gratitude. It is so true what our healthcare workers have done over the past couple of years and are doing today. One of our most challenging moments for COVID that our hospital systems have ever seen is nothing short of extraordinary. They are truly superheroes. And for anyone considering a career in this field, talk about a job just full of purpose and frankly, a job that pays more every month that goes by and is more critically needed to get Minnesota through this really critical inflection point. Jobs in healthcare have great career paths. Laura Beath will tell you that, to be sure. They are jobs that have seen wages increase by almost 10% over the past couple of years in many cases. And they provide long-term sustainable careers with chances to grow, chances to move laterally into different fields as well. And oftentimes you get trained right on the job, or you can get employers to pay for your training directly. So these are great jobs. As the commissioner noted earlier, about 400,000 people in the state work in healthcare. In Ramsey County alone, 35,000 healthcare workers. But when we look here at our department at the whole healthcare ecosystem and the trajectory that's ahead, we know that the job vacancies in Minnesota right now are approaching 40,000 for healthcare, 40,000 open healthcare jobs. And this is a problem that's not going away. We think in the next 10 years, you'll see about 80,000 new healthcare jobs, so additional to the ones we currently have in the state, grow here in Minnesota. So this is something we have to be working together on. Highlighting Healthcare Workforce Month here together as a state and as one of our state's biggest counties here in Ramsey County is just really important to highlight the possibility these jobs entail. And, I think for so many Minnesotans who have, gone into this pandemic understanding that there's now this really disruptive environment where everyone is kind of reevaluating their place in the job market and the opportunities that they have and which industries are growing, which industries are not. Healthcare is growing, and Minnesota has long been a healthcare leader. And these jobs provide a tremendous opportunity for our state to once again carve the pathway forward into this next chapter of our economy. So just grateful you all are doing this. Really appreciate it. Ling, thanks for inviting me, and commissioners for doing this work, for your leadership in this effort. It's so critical. So on behalf of the governor and state government, just want to echo our thanks and partnership with all of you. And let's go do Healthcare Month and do it well here for Minnesotans and help our healthcare workers. Thanks, everybody.
Thank you so much, Commissioner Grove. We appreciate the partnership as well. And so, Ling, I think you said Laura Beef is next.
Thank you. And I want to just echo my gratitude and thanks to all of the commissioners, and to also just Steve Grove for your leadership and helping and supporting the need for Healthcare Month. I also know I have the chance to just tell you what you all know. Ling Becker is amazing. She is the best partner, and she listens to us and supports us, and I couldn't find a better partner. So Ling, I just want to call that out because you are always exceptional. You got your pulse on what needs to be done. But what I want to share is it is such a critical time, and you're hearing in the news all of what's going on. And there's probably every single one of you have had a family member or probably a friend or neighbor that's had COVID. It has been a serious impact on worker shortage. We already had a worker shortage ahead of time, but this really spiraled for us with people retiring early, people needing to take care of their kids and their parents, and just fearing the environment. We have such a need that we need to inspire people again to be heroes and go back into healthcare, to sign up. And it is truly, truly an amazing field. I've been in the field for 30 years. I've run our talent management and talent acquisition the last 25 years, and also been on the governor's board since 2004. And I'm with my peers all the time across the state. They have the same needs. So when I'm speaking, you can say I'm speaking for all the other leaders in Ramsey County and across the state and country, that we really need to think of healthcare as a quality of life measure. As the commissioner said, we have fantastic pay and benefits. The other part is it's an opportunity for all of us in healthcare to hire locally. We take pride in hiring locally, partnering with all of you and with our schools and our community-based organizations and nonprofits to advance people. As I mentioned last week when I was in a presentation with Commissioner Grove, I've never seen a time in history where someone can get support, and we'll pay, for their education, we'll pay for their career development to move up the ladder, and they're getting an opportunity to earn and learn at the same time. We're all committed as employers, but we can't do it alone, and we're doing it with all of you. It also is an opportunity for individuals to use their head and heart. And so I can't think of a person that wouldn't fit. If they like research, they can come in. If they want to be in more of a support role, they can be in a support role or infrastructure or clinician. I started in the clinical area many years ago as a frontline worker. And I was an EMT, I was a medical assistant. I went on for associate, baccalaureate, graduate studies. And eventually I'm a VP today. I've been a vice president for, but you can start off as an entry-level worker and move your way up. I can share that. I was one of those. And, healthcare leaders want to develop people. I just also want to share that when we talked about the number of openings, I'm one organization. We have 3,700 openings, over 2,800 openings in the Fairview system, and over 800 openings in Ebenezer. And then we have almost 100 provider openings. We just have such a need. And if we can somehow, again, encourage, inspire, partner, direct people to us, we're going to take care of them. We're trying to be as flexible as possible. We've got, referral bonuses, sign-on bonuses, retention bonuses, great tuition programs. So please, just know that you don't have to have one job in healthcare. You can have your whole career. You can have 30 jobs in healthcare, and we're going to be there side by side. I also want to just share a little story. This is a little bit emotional for me, but a family member passed away Friday. I spent last week in the hospital almost all week. At first, only one person could go because of COVID protocols. So my son was there. And I was in the background. All of our healthcare workers are tired, but they showed up. We were on 3 floors. We're in the ICU, we're in the heart center, and on the hospice unit. Every nursing assistant, every nurse, every chaplain, every doctor showed up and did a fantastic job. For our healthcare system that is so tired, I was so proud. That's what they do every day. And that's what we have to remember, because, they're tired and they want people, to support them instead of, sometimes it's, people are like getting, I think, worn out with the pandemic. These clinicians are going in every single day and they're just amazing. And I couldn't have been more proud to see how they took the time to be with my son as he lost his father last week, every single day. So I'm just thanking all of you and showing gratitude for partnering with us on this important month. And hopefully it'll turn into the next important month in the whole year. But you can count on us. If you see an opportunity, Ling or any of you can call me. We'll work directly with someone or directly with anyone you want in your area. No one is saying no. We're trying to figure out how to make it work with everyone. So I just want to thank you and thank Commissioner Grove and Ling. You're just the best. And I'll let Ling turn it over. Tanya's on my team. She's amazing. She's one of those providers that's seeing people every day in the clinic and in our, she's teaching healthcare workers too. So thank you, Ling, for including me.
Thank you so much, Laura, and our thoughts are with you and your family as well. I'm going to turn it over now to Archie-un. And I'm sure I mispronounced that, so I apologize.
You was close. It's Arshian.
Okay.
Okay. Hi, everybody doing? Thank you for having me as a guest. I was like, wow, it's a lot of people here. I've never been on the board meeting before. So this is new. So thank you for everybody for having me. Don and Ling, they invited me. I am a healthcare worker, and I also participate in the CNA program. I actually take my CNA this Thursday, so I'm super nervous. I am super, super nervous. I've been studying like crazy. So
we'll hire you. Tanya will.
I'm super nervous. So I'm like, whoo, this is gonna be a big day. But I just want to thank everybody on here. I know I personally don't know y'all and y'all personally don't know me, but I just want to thank everybody for everything y'all do and supporting us healthcare workers. I'm a full-time worker. Don and Rose know that every time they call me, I'm always at work. Every time I'm doing a meeting, I'm at work. I actually got to go to work tonight. So, yeah, I just want to thank everybody for support and backing us up, so, and the Miss Lady Laura, if I'm saying your name right, hi, thank you for sharing that. Thank you. And my heart goes out to your family. So thank you for sharing that. Because, we do see that every day. And it's hard because we have connections with our residents. In my field, I work through an agency, so I travel. I'm a float. I travel to different independent homes, facilities. I travel to hospitals. I travel to clinics, to wherever they need extra help at. That's what I do. I work through an agency. So just traveling, it's a higher risk for me because, I did catch COVID. I just got done with my quarantine. I'm back at work. So, I put myself in a higher risk, but it's like, this is what I want to do in life. I know I sound crazy, like catching COVID, and people are like, well, you going back? Yeah, I'm going back. That's what I want to do in life. I want to be an OBGYN. That's my long-term goal, is to be an OBGYN. I have my own office, and then you know how that goes, and go to college. Because, healthcare is I've been doing it since I was 16. I'm 22. And this program, the CNA program, was just so beautiful. And the last meeting we had, the environment was so nice. And I was in a class with 4 of the girls, and they all was healthcare workers. And I was the youngest. Everybody was older than me. I was the youngest one in there. And just being in that environment, and my teachers, they was just so positive, and everybody was just so positive, and everybody was sharing their experience. And we had sad stories, we had happy stories. Some of them had connections with their residents. Like, it was a couple residents that I have that I still remember to this day, that I had connections with, and I have connections with their families, rest to their souls, because they passed on. So the program was just the best thing I ever done in my life, honestly. It just opened my eyes to so much, like, it was just like, that's where I wanted to be. This is my heart. This is my career. This is like another life goal. Like, this is everything to me. And we took 2 practice tests. One was 75 questions, one was 60 questions. And the test was kind of hard. It was kind of tricky. And, me and the other 3 girls was just like nervous. She kind of kicked us out the classroom. She scored our test. And I'm just like, I'm going to drop to my knees if I fail. Because, I study so much, and every day working, take care of my baby and studying. And when she came out that classroom and told us that every single last one of us passed, we all got an 80% or more. Every last single one of us on both tests. So I'm just like, oh my gosh, like, my hard work is coming true. Like, everything I'm doing, and I'm just not doing it for me. I'm doing it for other families. I'm doing it for my baby, showing him, mommy is making a difference, not in our lives, but everybody else's lives. So it is emotional, because I go to work every day and I build these connections with families, and I build these connections with my residents and patients. And it's just like, I want everybody to get better. And when a life passes on after I have a connection, I do cry. Like, I keep it together, but I go in my break, or I go in my the bathroom, or my privacy, and I do cry, because it's like, I talk to y'all every day. I take care of y'all every day. I pass out meds to y'all every day. So when y'all passes on, and I see the families and I try to comfort them, it breaks me down. But we have to keep it together as healthcare workers. We have to keep it together. We can't cry. We can't, we just can't do that. That's, it's policy, because we got to keep it strong for the families. So we have to keep it together. It's really hard. It is really hard. So we have, I have to come home and pray that I can keep myself together and keep my strength, so I can help the families. I have to always say, like, be a guardian angel to the families, because I have to make sure they leave out satisfied, and we're behind the scenes. We see everything. I used to work at Children's Hospital, and then Children's Hospital is kids, and yes, I've seen deaths. So it's like, with the babies, that even hits harder. I have a kid, so I've seen it. I've done it all. So yeah, I'm just glad, Laura, for sharing that story, because when you sharing that story, I almost got teary-eyed, because I'm like, I dealing with that every day. It takes a toll on you. But I'm very spiritual. I pray with my residents' families, because I go to the facility that I'm at currently, that I'm staying for a while. They're Catholic. It's a Catholic facility. So, they got prayer, they got, priests, and they got a church in there. So, just praying and being spiritual is what keeps me going every day. This keeps me going every day. So yeah. So thanks for having me, guys. I know it's a long story. I just had to let that, be known, especially since she shared that story. I just want to let you know we're here.
Thank you so much, Archeon. And you have a whole board of champions rooting for you. We're anxious to hear the results of your exam. So good luck with your CNA test. And thank you for sharing and being part of the program.
Thank you so much. Sorry.
No,
I'm
it's all
sorry.
good. It's a testament to the good work and for your heart. So thank you very much.
Thank
Um,
you.
with that, I'm going to turn it over to Ling Becker for final thoughts, and then Commissioner Reinhardt has her hand up.
Yeah, thank you, commissioners. Thank you to our guests for your time today. I think you were able to hear both from a big picture, the impact that healthcare has, but also from Archeon that, you know, each of our residents and program participants has a story and a lot of backstory to the work that they're doing and the hard work that they're doing to get into this industry. I would be remiss not to mention that Archeon had a couple of great employment counselors, Rose Simmons and Don Colliander, who are on our staff, who supported her through her efforts and her class. And then also just, I know Sarah Holly's on the call, and we want to recognize obviously all the employees of Ramsey County, both in social services and in public health. So Commissioner and Chair, if that's okay, I might just see if Sarah has any final comments. I do want to say that we have a whole slew of healthcare events for Healthcare Month, so folks can check our county website. We have a large job fair that'll be happening on the 18th, as well as 14 days of healthcare careers, which is going to be a program where any resident can connect to an immediate job counselor to help them navigate the healthcare pathway. So look on our Ramsey County website for more information. So with that, I'll turn it over to Sarah.
Thank you, Director Becker, Madam Chair, Commissioners, County Manager O'Connor. I just want to say, you know, on behalf of myself and Director Berry, our healthcare providers in public health haven't given up on us. And I can't stress that enough based on what everyone shared today, the stories, the intimate stories of our experiences dealing with this pandemic. And so my message is really brief today, that we can't give up on them or each other. And I think the best way that we can honor the work of everyone in healthcare and public health and avoid these continuous waves of COVID-19 in our community, again, continuing to get tested, vaccinated, masking up, and doing our part as Ramsey County residents and Minnesotans. And so I just want to stress that we are incredibly thankful for everyone's contributions over the last 2 years. We are continuing in this fight to end COVID. And so I just want to thank social services, all the people that are working in our care center in Lake Owasso. I want to thank correctional health, clinical services, our medical director, Dr. Lynn Ogawa, Dr. Van Franken, all of the healthcare workers at Ramsey County in public health and in many spaces, and our vaccine clinics, and Incident Commander Laura Anderson for continuing to find ways to continue to build the capacity of our workforce here at Ramsey County. So thank you everyone for being here today. And thank you, Director Becker, for always including public health and social services as a really important part of continuing our journey to improve and build capacity in our healthcare system. Thank you.
Thank you, Director Holly. Commissioner Reinhardt, who's been patiently waiting.
Thank you, Madam Chair. And I guess at this point, about all I can say is wow. Archeon, Laura, Commissioner, all of the people that spoke and shared very personal stories. And the first thing that, as soon as this was presented, honestly, the first person I thought of was Ling Becker, because before COVID, it's hard to remember before COVID, isn't it? Before COVID, when looking at the Pathways program, we had manufacturing first, of course, and then moving into other areas, and healthcare was one that has been recognized. As was pointed out, there were shortages before. And now it's actually at a very, very critical stage. So I just, the work that's being done, the pouring out of hearts from our staff and from the healthcare workers, everyone involved. I mean, it is a partnership. It is working with individual families and trying to improve the whole system. And so I think it was Laura that referred to them as heroes, and I think we all feel the same way. And I just want to say thank you to all the heroes.
Thank you, Commissioner Reinhardt. And thanks again to all of our guests for joining us this morning. With that, as appropriate, we're going to move into a COVID update with our Ramsey County heroes presenting lots of updates and stuff. So welcome to the team once again to present and thank you ahead of time for your work and moving us forward. So I'll turn it over for the COVID update.
Thank you, Madam Chair and members. Good morning. Thanks to everybody who is a part of today's proclamation. I'll go right over to the public health team to get us into this week's update.
Thank you, Madam Chair, Commissioners, County Manager, Deputy County Managers, and everyone listening this morning. It's great to be back with you this morning. We have a lot to cover. A lot is happening on a daily basis. And so we're just grateful to continue to have this space and to really represent the heroes in public health and in healthcare each and every day, and lifting up the incredible work that they're doing to stay ahead of Omicron and just COVID in general. So Omicron, as I mentioned before, remains the dominant COVID variant across the United States. Within Region 5, which I talked about last week, it's accounting for approximately 93.7% of new infections in the US, according to a recently revised CDC model. We're seeing high levels of community transmission across the US. If you take a look at the COVID tracker, the entire United States is red. We're seeing a positivity rate of 29.3%. This is across the US, a 7-day case rate of 1,422, and more than 141,000 Americans in hospitals with COVID across the United States. Today, I'd like to highlight what St. Paul Ramsey County Public Health, our partners, are doing to help our community achieve the recommended layered prevention strategies that we talk about each and every time we come before you here at the county board meeting. And we need everyone's help to do so. And so I'll just start by saying, get your COVID vaccine, get that first or second dose, and get your booster if you're eligible as soon as you can. It's so important. Here at Ramsey County, we continue to implement vaccine clinics across the county. We recently opened a new school site at 3360 Colborne, and we're really excited to continue to keep vaccines as one of our #1 priorities to mitigate the spread of COVID. Again, you can find more information about COVID vaccines at the Minnesota Department of Health website and also on our Ramsey County website. I had the opportunity to talk with a resident this week that was looking to get a booster. And they, I think it just essentially forgot that we were offering vaccines in Ramsey County. And I said, we have appointments galore, and they were so grateful. So I just want to share that story. And it was an essential worker that needed their booster. And so one thing I'll just shift to is that recently CDC is endorsing a COVID-19 booster shots for teens 12 to 15. And so we are now offering those boosters to people 12 plus who are 5 months from their previous series. And so Dr. Ogawa can talk a little bit about that shortly. Everyone in Ramsey County and in Minnesota should wear a mask in public. I can't stress that enough in indoor settings. Please consider wearing a KN95 or surgical mask, but any mask indoors is a good mask. And I think you've heard Ogawa talk about this, right? But we are encouraging people, if you have access to KN95s or surgical masks, please consider wearing those, especially in indoor settings or congregate settings. I want to mention that we are continuing to send out masks to community on a weekly basis, and we'll look forward to adding in surgical masks and KN95s as we receive them. I want to encourage employees in Ramsey County and across the state that are providing direct patient care or essential services to consider wearing the KN95 and surgical mask. And so my team is working to get that out to our various partners internally to make sure that our staff are protected and remain safe and healthy, as was mentioned earlier. I'll just mention on January 5th, Mayor Carter renewed mask requirements in the city of St. Paul, requiring face masks to be worn in public spaces that are city-controlled facilities and at all businesses licensed by the city of St. Paul. Mayor Jacob Fry did the same in the city of Minneapolis. Now I'll shift to getting tested. Testing, right? Oh, testing. St. Paul Ramsey County, good news, will expand testing capacity over the next 5 weeks in Ramsey County, since we know that mitigation through testing is still the best way to slow the spread behind vaccines. And we know that this is our job as public health as we continue to respond to this pandemic. I will have more details as we finalize this plan to offer community testing. And I just want to mention the incredible work that our team continues to do to expand our capacity to do this. We have been participating in a small pilot in partnership with MDH and other local public health to offer quick tests at our shelters and through some of our existing public health programs, such as Family Health and WIC. And so we've been doing that over the last week, and we'll continue to do that as we continue to explore options for expanded community testing in Ramsey County. I want to shift to statewide information. Governor Walz announced increased testing capacity in the Twin Cities metro area. We're seeing that there was expanded capacity up to 50% at Roy Wilkins last week. So example of that is they went from maybe 2,000 tests to offering 3,000 tests, I think, weekly. A site in Anoka will open Friday. A site in North Branch will open today, and a site in Cottage Grove is opening Thursday. So we're seeing expanded testing across the state. This is great news as we're seeing 2+ hour waits for a same-day test at some places. So please visit the Minnesota Department of Health website to see where those expanded testing hours and sites are being offered. I want to shift for a moment to talk about Vault Health tests that recently they set a daily limit because of the increased demand for at-home saliva test orders. And this is due to basically a nationwide request for at-home tests. And I want to mention that those are PCR tests. And this includes free at-home tests for Minnesotans. And so that is still being offered through the Minnesota Department of Health. There just may be delays. We also know that people are waiting a few more days than normal to receive their test results. According to CEO of Vault, over 50% of the Vault staff have been affected by COVID, which explains some of those reporting delays. Starting Saturday, another bit of good news. Every day we have news, right? As of Saturday, at-home tests will be covered by insurers. And so just finding that out yesterday, that people will be able to purchase up to 8 at-home tests, and those will be covered by private insurers. Finally, again, just want to stress a few points. If you are sick or have symptoms, stay home. Last week, I highlighted the pending change to the CDC isolation and quarantine recommendations from 10 days to 5 days. We are waiting for official guidance from MDH on this recommendation, and we are working to review the setting-specific recommendations based on the information that has been shared by the CDC with HR and our team. For now, Ramsey County is still operating under our current guidelines. As I wrap up here, please, continue to try to avoid in-person meetings, stay 6 feet apart if you're in those crowded settings around people that you don't live with. Avoid crowded settings or poorly ventilated indoor spaces, and continue to wash your hands, use hand sanitizer. We're really working together as a community to stay safe and stay healthy and to really get past this variant, this surge that we're faced with. Now I'd like to turn it over to Incident Commander Laura Anderson. Thank you.
Thank you, Director Holly. I'm going to go ahead and ask our colleague in communications, Mike Lindsay, to go ahead and put up that case dashboard. Thank you so much, Mike. So what we're going to go ahead and start out with is just sharing some local level data on case rate and positivity. Mike, would you go ahead and scroll down at our, a little bit further, I'll go back to that area. Yep. Community transmission data. This is what I want to highlight for the board. Taking a look at the data for Ramsey County, we are currently sitting at a little bit more than 900 cases per 100,000. These are cases as identified through a PCR test that is run through a lab. So you will not see over-the-counter rapid tests. You will not see antigen tests in these diagnosed cases across Ramsey County. Mike, would you go ahead and scroll down and take a look at that positivity as well? Again, these are really unfortunate and incredible numbers to look at. Something like 24 to 26% of those tests coming through PCR tests, again, run in a lab setting, are testing positive at this time. I think that here in Hennepin, as well as in Ramsey County, we're absolutely seeing the impact of an Omicron variant. And I imagine that we will see increased positivity in outstate Minnesota in the weeks to come. I do want Mike to scroll back up, as I think he was interested in doing so, and take a peek. Yep, these two graphics have been updated by our colleagues. Again, our epidemiologist, Nora Moore, as well as a colleague in communications, Christine Grill. They've gone ahead and separated out reinfections from new cases. So you can actually scroll down and once more see the impact of that Omicron variant. The difference here, you know, a reinfection is basically someone being diagnosed with COVID-19 more than 90 days from a prior infection. So that could include individuals in congregate settings, healthcare workers, or just members of the general public who unfortunately, you know, may have been diagnosed with, you know, the original virus as we know it, or Delta, and now unfortunately they're getting hit with a much more transmissible variant called Omicron. Mike, if you could go ahead and scroll over to the vaccine dashboard, let's take a look again at what we're doing locally to reduce transmission of this disease. If you could scroll down a little bit further, Mike, let's go ahead and take a look at our local summary. So just a reminder now, when we're talking about vaccines provided, Ramsey County provides something like 10% of all doses given to our residents. We do not turn away individuals who are obviously residents of other communities. We just want to make vaccine as accessible as possible. So we are at a point where we've given a little bit more than 67,000 doses at our Ramsey County clinics. We've continued some smaller redistribution agreements with local pharmacies and smaller clinical settings to make sure that doses are available at other locations for our residents. Over the past week, we gave a little bit less than 500 vaccines at our major clinical sites, as well as through existing operations. So again, think about, you know, how we can best pair vaccine with existing services. We will continue to provide vaccine through our family home visiting program, through our existing clinical services, correctional health, syringe exchange, just trying to get as many doses out there as we can. I think, Mike, if you will go ahead and shutter that screen, that's the information that I have available to present. I just do want to reiterate our intention, again, is to continue to provide those pediatric doses and booster doses particularly. We understand, you know, our partners at the CDC are indicating that folks who are unvaccinated are many times more likely to pass away as a result of a COVID-19 diagnosis than those with a booster. We are continuing to provide gift cards at our clinics for individuals who are seeking their first dose with us. It's a $50 Visa gift card. We will make sure those are available while supplies last. I'm thinking they'll be available through the spring. And then lastly, just an FYI, we are hosting an informational a handful of informational sessions with our trusted messengers. So this program has been spearheaded or facilitated through Sarah Holly and the research team for a little bit less than 2 years now, but we're going to go ahead and make sure that we have good substantial programming with those messengers to continue to address vaccine hesitancy or myths that people may have about mRNA vaccine. So excited to talk with them more about funding and strategies to get good health education out to our community, leveraging some ARPA dollars. I will go ahead and pass the mic now to Dr. Ogawa. Thank you.
Chair Maniscalco, commissioners, thanks. I sort of feel like I'm batting cleanup, so they put me in at the end. But actually, really, I want to focus on a few of the things that I think are exceptionally important that actually Director Holly already mentioned. First and foremost is still that, and Incident Commander Lori Anderson did too, vaccination is still the best way to keep individuals out of the hospital and from dying from COVID. You know, we've seen numbers as high as 20 times. You know, individuals who are unvaccinated are 20 times more likely to have complications associated with this infection. And, you know, we know that we cannot promise that vaccination will keep people from getting the infection, but we can really assure the public that it can keep them alive and keep them from needing to be in the hospital. And just as we spoke at the beginning of the meeting, healthcare is overwhelmed and tired, and individuals are with rates this high in the community, those who are working within our healthcare system are members of our community, right, as well. And just as Director Holly mentioned, we see labs slowed because lab staff have COVID, and thus those numbers are down. We see hospitals having fewer beds available because staff are COVID positive and tired, and their staffing is down. And so everything that we can do as a public to protect ourselves, to protect the rest of our community, is exceptionally important on all fronts. I will mention that we're seeing, outbreaks and high numbers of cases throughout the city, including our own correctional facilities. We are doing our best working with jail administration and corrections to make sure that everybody is staying safe, but the same space and staffing issues are popping up as well. And so we're all doing our best. As the public can also do their best in getting vaccinated, also can't stress enough that if people are feeling sick, to stay away from other people right now. The reason that we're picking up testing is because when individuals are vaccinated, the presentation of this becomes much more muted. And so the sniffles, a little bit of a sore throat could easily be COVID. And so getting tested, staying away from others, using masks, exceptionally important to protect other people right now. And if it means that it takes a week to get tested, stay home for a week if you can. Understandably, if you can't, you've got to be masked and following all the other mitigation. I'm just going to throw out there's a actually very good study that showed that if we have a room full of individuals who are wearing simple masks, cloth or standard surgical, but everybody is wearing them, it's equivalent to everybody being in a KN95. And so the more people who can mask, the more we protect others. I will highlight that boosters are now recommended as early as 5 months. And so getting out there, not waiting that 6 months for boosters, I think is important. And then last, one tiny shameless plug for another community conversation with Dr. Ogawa to answer any and all questions on January 19th. It's a Wednesday. I'll be available from 4 until 5, and hoping to get a lot of people coming to talk about Omicron, to talk about any of their questions and concerns. So I will turn it back to County Manager O'Connor, and we'll stand by.
Thanks, Madam Chair and Commissioners. We're moving to a bit more of a bi-weekly COVID update moving forward. We're going to do the deep dive every other week, and we're going to do a little bit more of a by exception of anything standing out, quick hit the other weeks, particularly as we talk about homelessness at some of our upcoming policy discussions as well, and continue to bring that issue to the fore, which both obviously has been a part of the COVID experience, but we need to be real, was here well before. And housing instability requires some immediate solutions, and we can't let it fall to the side. Other than the schedule side, I want to second the piece around continuity of service delivery in a moment of challenge. We'll talk about the federal court trial coming our way during County Connections as well. But as these case rates go up, they happen within our organization as well. As of now, I have no continuity issues to report, but I will tell you we're being more strained than at any other point during the pandemic for service continuity, and we will keep you updated as needed going forward. With that, Madam Chair, we all stand for questions. Thanks to the team.
Thank you, and thank you to the whole team. Again, we're celebrating you by proclamation, but we celebrate you each week as you're doing this great work for all of us and keeping us safe. I will share, I'm following your guidance. Our COVID has hit our household. We are in quarantine. We have 3 positive tests, so we're just assuming we're all positive at this point. So leading by example and listening very closely to your guidance each week has advised us. So, and again, only one had any kind of sniffles. The rest have had no symptoms. So I think that's really important that we're testing positive with no symptoms. So we're here in quarantine at the Mattis Castillo household. I also wanted to share quickly, and we'll get to questions, just as a reminder to the public watching and folks that our healthcare staff is is working really hard, and especially at those vaccine and testing sites. Yesterday, there was an incident at the Roy Wilkins testing site that got physical. Police had to be called. A staff member was assaulted, not one of our staff, a Vault Health employee. And imagine that you're working in conditions where really sick people are coming and spitting around you all day. You're not, they're working long hours, people are strained, and then to come in and have to be treated badly is really, truly a crime. And so just asking everyone to be patient in this work. Everyone is stressed and tapped out. And if you're not feeling well, right, on top of it. So just remind that our healthcare workers truly are doing the best they can, and we have to be patient. As we know, and we've heard from all of our staff, the whole system is stretched thin because people are sick. And so just to be a little bit patient. I have questions from Commissioner McGuire and Commissioner Reinhardt. We'll start with Commissioner McGuire.
Thank you, Madam Chair, and I really appreciate your comments too about being patient. And also, I just want to add my thanks to all of our healthcare workers in Ramsey County and everywhere for all of the work that you're doing. And thank you, Director Holly and Incident Commander Anderson and Dr. Ogawa for your reports every week and all of your work. I, as always, have a few questions. And Dr. Ogawa, just to affirm, you had said that boosters are available at 5 months. That means 5 months from your last shot, not 5 months old, right? I just want to make sure that the public doesn't think that it was at 5. I heard it, I'm like, oh, children can get boosters. No, it's at 5 months after your last shot, right? I just want to affirm.
Sorry about that. Yes, thank you very much for correcting that. Yeah, otherwise we're going to have a rush at our sites. But yeah.
Yeah. Well, I think people are anxious many people are anxious to get their kids vaccinated. And my question is about those that may not be so anxious to get their kids vaccinated. I have heard questions from people like say, well, my kids have already had it, so I don't need to get them vaccinated. And they're probably safer now than, a lot of people. And so they're not as quick to get them vaccinated. And could you just clarify that it still is important, even if they've had it and have maybe some some antibodies there, that they should still get vaccinated? Can you just talk about that a little bit, please?
Absolutely, Chair Maniscalco, Commissioner McGuire. One of the data that Incident Commander Laura Anderson pointed out is that we're seeing reinfection rates, and we're seeing a bump within those reinfections as well. And that's very concerning, especially, I believe, we're seeing it because Omicron is different. We recognize that it is different and has the most changes within its capsule as any of the other variants before. And so right now, being vaccinated and boosted still matters, even if you have had immunity from infection before, and in fact expands that immunity and helps protect even more. And so we've had a number of conversations even in the past about infection-based immunity and how the vaccination-based immunity seems to last longer than standard infection-based. I'm being careful a little bit about words because we don't want to call it natural immunity. It's really based on an infection. But vaccinated immunity from vaccination is still recommended and important.
Yeah. And so thank you for that. And right now, kids over 5 can get vaccinated. Is that where we're at? Is that so? Younger kids who have been, who have received it, they're have a little bit of immunity, as you said, infection-based immunity, but they still can't get vaccinated. So you just have to still be really careful with all those younger kids, and perhaps their ability to still spread it to others, maybe older people. So thank you for that. I really appreciate it. And thank you for doing your Wednesday, January 19th call, because I know those are very popular and I love sitting in on them because I learned so much on them. So thank you for doing that again. I appreciate that. Thank you, everyone. And thank you, Madam Chair.
Commissioner Reinhardt.
Thank you, Madam Chair. Well, as I have stated many times before, I don't think there's probably more than a day that goes by that I don't say Dr. Ogawa says. And I think I know that everybody is COVID fatigued, but I really, I don't get out a whole lot, but going into places where masks are no longer required, and seeing how many people just don't, I mean, it's such a simple thing to do. And because people are tired, they just want to go about their business. And I would say, we don't see as many people with their masks on. And I think that that's unfortunate, especially right now. I think one of the things that was pointed out by staff, including Dr. Ogawa, was that we are in a spike right now. I mean, over 20% positivity rate, and that's of the ones that we know. That's not all the home tests and different things that we're doing. That's just what we have for Ramsey County, the data. This is from everything that we've seen, and maybe Dr. Ogawa or others can comment on this, but it appears that the spike from Omicron, because it happened so much quicker than with Delta, where that took like 3 months, that it seems like what's happening around the world is that this is peaking and continuing for about 3 weeks, how quickly it has taken over. I guess what I'm kind of hearing is that, this isn't something, the Omicron surge is not going to last for 6 months. But to get some idea of when can we expect, if there isn't another variant, that we will be in a little better shape. I don't know how else to put it. I mean, is it true that, if we can just, sometimes people need to know that they don't have to wear the mask for the rest of their life. Although I have to tell you, when it's really cold out, I was kind of glad to have that mask on. It was like, yeah, I'm keeping it on outside. But I think knowing that this isn't something that's going to last for, Omicron's not going to, until we get to the next one, I guess, but that we've got a timeline that if you can just, say, okay, I need to do this for 2 weeks or 3 weeks or something, even if you don't want to do it right now. And I know that's kind of a cop out, but people are not taking this seriously. Recently, there was a death in my extended family, and I have family members that are immune compromised, and I called and said, please don't come to the memorial. It was a hard call to make. But, for people that are immune compromised, me wearing a mask is really a gift to them. You're protecting yourself, but really what you're doing is protecting other people. So if there's some way to know really what are we looking at as far as the trajectory of Omicron. I know there's science to this, but it's also just, what's happening and what people are doing as far as vaccination and masking.
Chair Modis Castillo, Commissioner Reinhardt, I'd be happy to answer that. We do have some data available to us from larger cities that appear to be slightly ahead of us in this surge. New York City and Chicago are the 2 places that come to mind where they've had earlier spikes. I was reading an article by Michael Osterholm, who's a prominent researcher at the University of Minnesota. It appears that we're looking at 4 to 6 weeks ahead of us, where we really will be in the highest peak for this variant. Hopefully that's true. It's like very, very transmissible, but ideally, we'll be looking at coming out of this in early spring.
Thank you.
Thank you. Thank you, Madam Chair.
Thank you again for a great update. We'll see you back in a couple of weeks, hopefully with not a lot of new news, but maybe improved reporting. And we hope that everyone stays healthy and safe. With that, we are going to move on to our agenda and administrative items. Commissioner McGuire. You're on mute, Commissioner McGuire.
Thanks, Madam Chair. I appreciate that. So I would like to move the following administrative items. Item number 4, single source agreement with model cities for emergency shelter beds. Item number 5, amendments to the joint powers agreement, with the Minnesota State Agricultural Society for law enforcement and security services. Thank you. Grant agreement from the Minnesota Board of Water and Soil Resources for state fiscal year 2022. Item number 7, grant awards from Minnesota Department of Natural Resources for state fiscal year 2022 Conservation Partners Legacy Program. Item number 8, joint powers agreement with the City of St. Paul, City of Minneapolis, and Hennepin County to apply for the Economic Development Administration Good Jobs Challenge.
Paul.
Thank you. Item number 9, project labor agreement for Public Works 2022 construction and pavement preservation projects. Item number 10, the 2022 and 2020 through 2026 Transportation Improvement Program. Item number 11, appointments to the Ramsey County Library Board. Item number 12, designation of one additional unclassified, unrepresented administrator, withdrawal management program, and detoxification position in accordance with Personnel Act, Minnesota Statute 383A.286, Subdivision 3. Item number 13, summary of the, okay, are we pulling 13 or 12? Or
13.
13, summary of the conclusions from the performance evaluation of the county manager. Okay, item number 14, 2022 authorization to participate in pooled food fund opportunities. Item 15, 2022 designation of depositories and delegation for electronic funds transfers. And item number 16, October 2021, report of contracts, grant and revenue agreements, emergency purchases, sole source, single source purchases, and final payments. Thank you, Madam Chair. I move all of those. Sorry, second.
Great, thank you. So just to make sure I didn't miss any, we have items number 5, 8, and 13 that have been pulled. And we are moving the rest. Any discussion? All right, no discussion. We'll take the roll call, please.
McGuire,
Aye.
Ortega.
Aye.
Thank you. Reinhardt,
Aye.
Carter,
Aye.
Fretham,
Aye.
McDonough,
Aye.
and Mattis Castillo.
Aye. All right, we'll start with item number 5, amendments to the joint powers agreement with the Minnesota State Agricultural Society for law enforcement. Is there a motion?
So moved.
So moved. Second.
Okay. And so I think Commissioner Carter pulled this first, so I'll start with you if you'd like.
Thank you. I very much appreciate the work that has been going on in order to define a transition, to make a transition possible, I should say, at the state fair so that the Ag Society will be taking over primary responsibility for policing and law enforcement services at the state fair. I appreciate this request that is coming from our sheriff for extension of our joint powers agreement, for ratification of the first extension, which the county manager did, and for the second extension approval coming before the board today. And I am going to be supporting the extension. I will tell you that as I looked at it initially, I felt as though the time frame for this extension is far beyond what should be feasible and approved, because we have a state fair coming up in 2022. the Great Minnesota Gathering. And we know that as the Ag Society is recommitting to a police department to take primary responsibility for the state fair in 2022, as well as for the state fairgrounds, it is going to take some time and work for them to recreate that police department and to be ready. I very much appreciated the conversation with Mr. Ramakar and Ms. Bryant, which they provided in advance of this meeting to answer questions, if there were questions from commissioners. And my question was, can we get this done sooner so that we are assured that the state fair will have its capacity and the ability to take over in time for the Great Minnesota Gathering? To have that occurring at the end of June in that very, very busy season for preparing for that state fair is a bit of a question to me. After talking with them and understanding the extent to which the state fairs work, must be engaged for that new police department to exist. I do understand the reason they're asking for the time. I would like to support that, but it is a concern to me that we would have no update or no specificity regarding the transition plan prior to the end of June. And so I would like to request an amendment that would have the state fair or the Ag Society and the Sheriff's Department return to us with an update, which shares specificity for the transition, progress on the transition, and any issues that need to be addressed, which, if not addressed, would prevent that orderly transition. I believe that should occur. I would like to hear from other commissioners on or before April 4th of 2022. That would provide me some assurance that we will at least understand midterm the ability to successfully transition at the end of June. That is the amendment that I'm offering then, that there be a midterm report on April 4th, on or before April 4th, 2022, provided to the Board of Commissioners.
Madam Chair, I would second that amendment, and I would like to add just a little bit to it. I think that the April 4th date, we need to have that come back to us. But I would like to see, because I think it's very clear that we are going to have, that there's not going to be an extension. We need to make sure that it is taken very seriously, that June 30th is when this contract will end. And so I would like to add in, quite frankly, because there's a lot of work to be done. And I really commend the State Fair and the Ag Society for reinstituting the police department, which clearly makes sense for them to do. And I know that there are opportunities for our individual officers to participate in that, just as they did before when they had their own police department. So I think that there's opportunities there as well. But honestly, I think that after the April 4th, I think that we should have monthly updates through the end of the contract so that we know. So if there, I mean, on April 4th, if there's some issues, we're not going to know until we get to really crunch time. And so, and I know that sounds like a lot, but we're only talking a few months. And with the state fair being in August, if they haven't made substantial progress by April 4th and then continue to work through that transition and have an update to us, we're going to be in a very difficult spot. So, Madam Chair, Commissioner Carter, I don't know how exactly
That's a friendly
how we do
amendment.
Yes.
To the amendment.
Okay. Thank you.
Great. Thanks to both of you. I wondered if April 4th is a Monday, if we could adjust that to April 5th so that we would have a board meeting.
Sense.
To
That
have
would make a lot of sense.
conversation if that's all right. So that would be a friendly amendment. So we have a motion and a second with a couple friendlies. I have Commissioner Fretham's hand up. I also want to acknowledge that we have Sheriff Fletcher is here with us and want to give him the opportunity to respond as well. And I apologize, I almost didn't recognize you. You're on a very small picture on my screen, and you seem to have shrunk in size a bit and looking very svelte, Sheriff Fletcher. So welcome to our first meeting of the new year. I'm going to let you respond a bit, and then I'm going to jump to Commissioner Fretham's questions as well. So Sheriff Fletcher, please.
Thank you. No problem at all, Commissioner and Madam Chair. With the April 4th date, we're glad to make timely reports back to you on their progress. Of course, we'll be getting those reports from the State Fair themselves. I can tell you that in today's environment, it's not easy to get applicants for law enforcement. And at the current time, I think they have 12 officers. They have applications and in process another 70. So I'm confident they'll get to where they need to be, but it's been a difficult couple months to recruit law enforcement officers into this particular field. Not to mention, a lot of departments are offering $5,000 bonuses for signing new officers, which makes it very difficult for the State Fair to hire people. And for that matter, it impacts us as well, as you know. But glad to work with that data. I'm confident they'll make progress and get to where they need to get to. And I knew it's been said, and you all know this isn't exactly the same document we had, because they have established their own police department. They have their own chief. So any additional liability coverage by the fact that they have their department, we have another layer of insulation in addition to the liability insurance policy.
Thank you, Sheriff Fletcher. I appreciate that. Commissioner Fretham.
Thank you. And it is good to see you, Sheriff. Glad you're here. I did have a good conversation with Sheriff's Office staff yesterday, mostly around concerns expressed by many of our contract cities about changes in their contracts and the connection to the State Fair. In that conversation yesterday, the impression I was left with is that any changes in cost to our contract cities this year were not a result of no longer patrolling the State Fair. It was other matters. And I'm trying to wrap my head around that. And one thing I asked for, that I've asked for a few times, is more information just about the contract cities and how that process works. You know, that about half of the jurisdictions for cities in a township that I represent contract with the Sheriff's Office for their patrol services. And better understanding that in the context of how the State Fair impacts that in terms of that mutual aid, I think would be really helpful, but just better understanding how the contract cities function would be helpful, so that when issues like this come up, I have a baseline to operate from. So I know when I talk to them, and I'll share with you as well, that I'd love to hear more about how this works. I'd love to have our contract cities invited to a workshop on this, and that to better understand how the administrative efficiencies benefit our cities, because I know they get a lower cost, which is great for them. Also ensuring that we are compensated for the time and efforts of the deputies that we employ in those contracts. So an understanding of that cost comparison and how that works out, in addition to, you know, data transparency. What are our cities getting for their cost in terms of patrol hours and calls? I think something, you know, equivalent to what a city that had their own police department would be able to have access to. I'd love to know more about that, as well as just the risk and liabilities of being a patrol agency. We know that policing is under a lot of scrutiny right now, and that there are more demands and calls for accountability, which I think accountability is always a good thing. So then the question is, what are our risks and liabilities if it is the Ramsey County Sheriff's Office doing that work, and are we adequately protected and compensated to manage for that? I'll say I think I differ, shifting. That's my ask for a workshop, and I did share that with staff yesterday from the Sheriff's Office, to just better be able to ground in that and make sure we're all on the same page. And then I think shifting to this specific RBA, I think I may be an outlier on this, that I have a lot fewer concerns about extending the contract, and that I wouldn't be opposed to be going further than 6 months. And I know I'm probably the outlier here. I think it makes a lot of sense for having our deputies involved in that patrol process. But I think having that data and reporting is an important part of that, and that follow through to build trust and transparency in the work that's being done, in addition to needing to really understand how the contract cities work more. So thank you.
Thank you, Commissioner Fretham. And I appreciate your questions and concerns about the contract cities separate from this particular agenda item. And Sheriff Fletcher, I think that we can work on setting up a workshop in the future. I hope that you'd be a willing participant to have that in the future. Did you want to make any other comments, Sheriff?
Well, just real brief, on the efficiency, rest assured what we found over the 30+ years is that the larger number of cities that are involved, the more efficient it is for supervision administration. And we can talk more in detail about that at a workshop. Cost-wise, we charge every dollar to the contract cities that they need to pay to make sure they're paying their fair share. In some cases, it is cheaper per capita to work with the sheriff's office than, say, Mounds View, New Brighton, because of the greater efficiencies. Liability-wise, all those cities carry their own insurance. So if an officer is, liable for something or injured, that we have, of course, insurance through those League of Cities, and they're covered as well. But on the big issue, the kind of elephant in the room about Falcon Heights, I have no intention of canceling Falcon Heights contract. They are losing their city manager here shortly. They got a lot of trauma that has gone on there, and we're going to continue to provide service to Falcon Heights. I have said, and I'll say again, it would be nice to have a contiguous city, Roseville, St. Paul, or the State Fair, that provides backup to those officers. That would be a safer way to do it. But in the short term, Falcon Heights will continue to be under the sheriff's office. That caused a crescendo, that discussion of Little Canada saying, well, if Falcon Heights leaves, will that raise our costs? And then White Bear Township said, well, if Little Canada leaves, is that going to raise its costs? We've talked with all those administrators, and no one has any intention of leaving at the current time. And the efficiency of the larger group means that their cost would raise if they did. So glad to have that workshop, but wanted to give you an overview of what you might hear at the workshop.
Thank you, Sheriff Fletcher. I appreciate that. Commissioner Reinhardt.
Thank you, Madam Chair. One thing that I wanted to comment on is that in the past, prior to this contract, Ramsey County deputy sheriffs were contracted with, but as individuals working for the fair. And so I expect that some of our officers will be doing that as well, but it's not under the auspices of the county and this contract. So there will be, just as there has been every other year, except for last year. And regarding the contract cities, and we do need to have that workshop, I think it needs to be understood that there are cities in my district, none of the cities actually in my district are under the sheriff, I don't think. But the concerns that they had were that they were paying part of the cost. Because when you see the sheriff's office going into communities that have their own police department, the people that are, the communities that are paying for that are wondering, okay, how does that work? Because, Maplewood is not a contract city, neither is White Bear Lake. And they don't want their taxpayers to pay for it either. So it's a double-edged sword as far as making sure that those costs are covered. And I think we've done a really good job in the last few years on keeping track of that. But there are questions that come from the opposite angle on this. And so it's not just a one-sided conversation. And that was, in fact, during the budget hearing, what we asked for as far as a workshop that did not happen, but hopefully it will this time. Those are important questions. And for the public that's listening, they're probably wondering, okay, what is the difference here? The sheriff's office covers the entire county. However, patrol services are a separate service. And some communities, a majority of the communities have their own police departments for patrols and the local law enforcement. And then others contract with the county for those services, but they are different services than those that are offered all through the county. And so that's why we're having this discussion, so that people can understand. Just as we had a contract for the state fair, which is above and beyond what the sheriff's office would do under statutory requirements. So it's the patrol service that we're talking about, and the patrol service for the state fair. I know that we all know that, but probably a lot of the public doesn't understand the difference in that. Thank you.
Thank you, Commissioner Reinhardt. Commissioner McDonough.
Thanks, Chair Mattis. Still, I want to go back to the RBA in front of us. I support the amendment. Commissioner Carter, I think that's wise to have an update midway through. I think listening to the sheriff here and the response that, you know, they're up to 12, but they seem to got a long ways to go. I think maybe even strengthening that amendment, that April 4th update would include a backup plan from the State Agricultural Society that does not include Ramsey County amending the contract come June, that they're working in partnership with the state partners about what that backup plan is if they're not able to pull this together as they see. And are hoping, because I think the sheriff has pointed out some potential risk here in that being able to occur. You know, last year we were kind of put into a box with their decision and the haste that was made in and the response that was done, and we stepped up, but it was very uncomfortable in having to do that. But we've made it all clear all along that this board does not support that ongoing effort. And I would not want to be put into that same position come June without the state fair having some other backup plan being worked on if they cannot pull off their own state fair police department as they envision. So I would suggest, or I would make a motion to either have a separate amendment that the April 5th update would include the potential for a backup plan to be able to help support that. That includes, that does not include Ramsey County as the lead agency.
Thank you, Commissioner McDonough. The powers that be tell me that a county manager has the language for the amendment. So I'm going to let him share that since we've jumped around a little bit. So County Manager O'Connor.
Thanks, Madam Chair. I'll restate back what I've got in notes in case I'm missing something, assuming that Commissioner McDonough's proposed amendment would be deemed friendly. Okay, I'm seeing head nod. So it would be an update on the transition by Tuesday, April 5th, then requesting a monthly update until the end of the contract, which I believe with the date as stated in the RBA already, and including a backup plan, for the April 5th part. Update on the transition by April 5th, that includes a backup plan that would not involve Ramsey County extending the contract beyond the contract date. So it is update on the 5th that includes that piece around not having to extend this contract, and then a monthly update until the end of the contract would be the third tenant.
Right, thank you. That's good. All right, so we're going to vote on the amendment first, and then we'll vote on the contract. Before we do that, I just want to give Sheriff Fletcher any last minute comments or thoughts, or if that amendment is acceptable from your seat.
Totally acceptable, and thank you for your time.
Great, thank you very much for being here, Sheriff Fletcher. With that, let's take a roll call first on the amendment.
McGuire.
Aye.
Ortega.
Aye.
Reinhardt.
Aye.
Carter.
Aye.
Fretham.
Aye.
McDonough.
Aye.
and Maris Castillo.
Aye. Thank you very much, Sheriff, for joining us today. We'll see you soon at a workshop that we'll work on together. Thank you. We'll move on to now item number 8.
Madam Chair?
Madam Chair,
Yes.
yeah,
Oh,
you
sorry.
said we were voting on just the
Oh,
amendment. Now
sorry,
we
yes.
have to vote on the, right.
Correct. Thank you very much. Now we'll vote on the RBA. Thank you. Roll call, please.
McGuire,
Aye.
Ortega,
Aye.
Reinhardt,
Aye.
Carter,
Aye.
Fretham,
Aye.
McDonough,
Aye.
and Maris Castillo.
Aye. All right, now we're done with that piece. And we will move on to item number 8. The joint powers agreement with the city of St. Paul and the city of Minneapolis, Hennepin County to apply for Economic Development Administration Good Jobs Challenge.
So moved.
Thank you.
Second.
Thank you. And Commissioner Carter.
Thank you, Madam Chair. Just a couple of weeks ago, I recall sharing that together with Greater MSP, we had heard the news that our region was approved to move into the second phase of the Build Back Better Challenge application. That's exciting because it's collaborative work that we're doing together with the region. I am so thrilled to be able to share or to ask, I should say, because she is still with us, our director, Ling Becker, to share a few words about this exciting work that we are now doing together with the city of St. Paul, Minneapolis, and Hennepin County, and applying for, with your approval today, the Economic Development Administration's Good Job Challenge. And if it is all right with you, Chair Maris Castillo, I'd love to call on Director Becker for that update.
Yes, thank you. Go ahead.
Yeah, thanks, Madam Chair, Commissioner Carter. I would just like to provide a little bit of context regarding this funding stream. As you know, we've all been talking a lot about American Rescue Act Plan funding. That is a larger bill that had many areas where funding went into. A lot of what we've been talking about has been around the state and local government share. Some of the funds actually went to the Department of Commerce, which is with EDA is within, the Economic Development Administration is within the Department of Commerce. There are 6 challenge opportunities within the EDA that are available for regions within the country to apply. And as Commissioner Carter mentioned, there has been a regional application forwarded for the Build Back Better Challenge into phase 2. This is another one of the challenges. It is called Good Jobs Challenge. There is $500 million available for communities, and they expect to award between 25 and 30 regions with funds. We have been working very hard over the last few weeks with the city of Minneapolis, with Hennepin County, and with the city of St. Paul around a joint powers agreement where Ramsey County would be the lead entity applying for this Good Jobs Challenge. And this challenge allows us to obviously bring more resources beyond what's available to us to support residents. And oftentimes it's not maybe in the best interest for the counties to apply for things when maybe other people are better positioned. But in this case, we feel extremely strong that the counties and cities as governmental entities make the best lead applicant for our region. We were approached by several community-based organizations to take this leadership role. In addition, the targeted population are our county involved residents, truly. They're folks that obviously typically are just as impacted, that have county involvement, SNAP, MFIP, veterans. These are all the designated populations that these dollars are designed to go toward, and certainly calling out people with disabilities and communities of color as well. So we are looking at 3 sectoral partnerships in technology, healthcare, and construction. We've been communicating with the community to help build the grant application and have identified 4 backbone organizations. For tech, we have identified MinTech. For healthcare, we will be working with HealthForce, which is the Center for Excellence for Minnesota State. And for construction, we are doing something extremely innovative in the sense of bringing a broader table together of both supporting trade and non-trade jobs that are needed in the construction industry. So we are partnering with the Minnesota Building Trades as well as the Associated General Contractors of Minnesota. This grant is well, it is due, found out the deadline was going to be due in January. There's a few more, but folks have been working really hard. I can't say enough about the regional collaboration. Truly the governmental entity brought forth their best word in work to build a really strong application. And so we look forward to asking for support from a lot of our community partners in the weeks to come here in the next 2 weeks. But we certainly, this is a key step in making this application possible, would be your agreement to the Joint Powers Agreement to apply. And I'm happy to answer any other questions.
Thank you, Director Becker. All right, with no other comments, we will take a roll call on this item.
McGuire,
Aye.
Ortega,
Aye.
Reinhardt, Reinhardt,
Aye.
Fretham, or I'm sorry, Carter,
Aye.
Fretham,
Aye.
McDonough,
Aye.
and Matas Castillo.
Aye. Thank you. Now we're going to move on to item number 13, summary of conclusions from the performance evaluation of the county manager. Is there a motion?
Move approval.
Second.
Second. Yeah.
Great, thank you. We have a motion and a second. I wanted to pull this item to take a moment and reflect and show our appreciation for our distinguished county manager, Ryan O'Connor. The last 2 years, we have collectively and individually experienced crisis and trauma, and through it all, the Ramsey County team has been able to continually adjust and not just operate, but exceed any expectations for performance and service delivery. That could not have happened without the truly exemplary leadership of our county manager. I wanted to share some highlights and themes that I heard from Ryan's performance evaluation from you all, and then I'll pause if you all want to add anything that I may have missed. I believe that not only reflects on his leadership, but pay tremendous credit to our executive team, our deputy county managers, and each and every employee in our organization. Under Ryan's leadership, Ramsey County as an enterprise has been able to continually learn from the past, to adjust and to improve our service delivery and engagement with our community. Ryan himself leans in to learning and course corrections and is on a path of continuous improvement and is determined to help us move from good to great. We've had some significant challenges along the way. We don't need to relive them all. I think we all know, and Ryan has consistently found new ways to take the high road, which not only positively reflects on him as a person, but it sets a tone across the organization. A significant part of the board's evaluation of his leadership in advancing the organization's work to increase racial equity. For a year of crisis response, the county manager has continued to aggressively advance the county's strategic actions to increase racial equity, including to structure the county's COVID-19 incident management to include the racial equity and community engagement response team and the equity action circle. So we've got 9 independently elected officials, 4,000 plus employees, 500,000 residents, and millions of visitors to Ramsey County, all demanding that we have a county of excellence that's open for business, and it has been possible because we have a county manager who keeps the day-to-day moving forward. He empowers his team to lead and innovate while truly embodying the county's goals of well-being, prosperity, opportunity, and accountability. In the year ahead, we will continue to focus on priorities that the board has set forth, as well as continue with key initiatives like Transforming Systems Together, TARP, Healing Streets, and continue to focus on improving communications and relationships with all of our communities and neighborhoods. Thank you, Ryan, for your continued distinguished service to Ramsey County. I also want to mention that with this board action, we are approving a COLA increase in alignment with unrepresented employees once approved by the board, and that we are deferring the consideration of a performance-based increase to the summer of 2022, and we'll be moving the future performance reviews to July. And I just want to open, if I missed anything, if anyone wants to add comments. I got 2 thumbs up, lots of thumbs up. Commissioner McGuire.
I know that we all were able to give a performance review and gave our comments to County Manager O'Connor, but Madam Chair, you did a great job summarizing a lot of that. But I just want to say how much we do appreciate the County Manager. The team that you've brought around you is second to none. And the comments I hear from the community, as evidenced by our board actions today with all of the community members that were on to compliment the great work that we're all doing and that the teams are all doing. I am always, when I'm in the community, I hear constantly how people are proud of the work that Ramsey County is doing. So, it's not without challenge and it's not without some struggle, but I just want to add my gratitude to you, County Manager O'Connor, and your team for guiding us and leading us as best as you can in these trying times. So thank you so much.
Thank you. And Commissioner Carter.
Thank you very much, Chair Matis Castillo. Having had the opportunity to work very closely with our county manager during 2020 and the second year, 2021, of increased impact from a severe pandemic and from so many other urgencies and crises that were upon us, I just want to add my sincere gratitude as well. You know, on behalf of all of us, of course, we have all shared the gratitude and appreciation for the work that County Manager has done, for his ability to build and to sustain the strong and committed and resilient, I might say, leadership team that we have, for being there together with that team, engaging across our community fully and being there with our community to take ongoing bold steps even through pandemic that will guide us forward in the strategic work that we are doing. This requires great leadership. It requires a great team. We have that. And of course, as we complete this performance review, to simply wrap it up with that thanks is my joy. I very much personally appreciate also the great support that the county manager and the team has provided to the chair and to all of us. So thank you so much for allowing me just to make that statement, Chair Matis Castillo.
Thank you so much, Commissioner Carter. Ryan, I don't know if you want to make any comments or you just want to bask in a moment of gratitude.
Yeah, there's always a risk, Madam Chair, right, of saying anything. I do want to extend my appreciation to the entire team. And by team, I mean every employee, but also every resident in this community. On good days and bad, we grieve together and we celebrate together and we move forward together and we all play roles in that change throughout our time living in the community. And you all play very important roles in that and deeply understand what I'm getting at. And so it's just onward together, and thank you for the kind words today. They are uplifting, and they're also a reminder that we never do this work alone or in a vacuum. And I look forward to this being a more optimistic and positive year than the previous few. This is a year we hopefully get to start to build out of a real challenging period, and I'm going to come to work every day believing that this is that year. Thank you very much.
Thank you very much. With that, we will take a roll call.
McGuire.
Aye.
Ortega.
Aye.
Reinhardt.
Aye.
Carter.
Aye.
Fretham. McDonough.
Aye.
And Matis Castillo.
Aye. All right, we will move to County Connections.
Thank you, Madam Chair and members. You put a hop in my step for County Connections. 3 quick updates for you today. if I could invite, we have Mr. Chetan Ganatra on here today joining us. I saw he was on the meeting earlier, so hopefully he can pop on and wave. Chetan has now joined us formally as Ramsey County's new Chief Information Officer. Started a couple weeks later than we had originally hoped, as Chetan had some other important things going on that he needed to attend to, and we're really excited to have him here as we hit the new year. As we've said before, we are deeply appreciative to Rich Christensen, the outgoing CIO, who I am happy to announce is a new grandfather of a new grandson. And so I believe retired life is treating him, it's a peak right out of the gate for him as he looks at that. Chetan, I wanted to give you a moment just to say hello to the board and anyone watching today. If you'd like to add a few words of your own as we welcome you to Ramsey County.
Thank you, County Manager O'Connor, Madam Chair, Commissioners. Thank you for this opportunity to be here. I just wanted to say that I'm extremely excited to be joining the amazing team at Ramsey County, and I look forward to serving the residents of the county in my role as the CIO.
Thank you, Chetan. We absolutely look forward to having chances to do even more and have conversations with you. Chetan comes to us after a distinguished career at many stops, most recently the Department of Human Services. And as we talk at previous board workshops around the complexity of interoperability of systems, how do we make them human designed so that they work better for the people who come in our doors virtually or physically every day, Chetan stood out as someone who is ready to take that work on from the forefront and lead, and we're very excited. So thanks again for being here this morning, and it was great to get to say hello to you here. Can't wait to see you again around soon. Two other quick updates, commissioners, today. I wanted to remind everyone that the ice castles have opened. I assure you they have not melted based on the weather that we started with here as they kicked off. They are, this is the second time in 3 years that Ramsey County's Long Lake Regional Park is the host to the ice castles, which is an amazing winter experience that includes ice slides, an ice maze, tunnels, and an artistic alcove. You can get reservations online at www.icecastles.com. I want to give a special thanks to Chris Linkowski over in the Parks Operations Division. He's the Division Director, Park Maintenance staff, and our partners at the City of New Brighton for securing and hosting this wonderful event again. And as we talk about COVID, being outside is one of the safest things we can do and ways we can find joy during challenging moments. The ice castles are one great opportunity thanks to Parks and Rec. Finally, I mentioned earlier, I wanted to close by mentioning the federal trial, upcoming civil rights trial occurring in downtown St. Paul. Just wanted to share some updates. Yesterday, county leaders hosted a staff town hall for impacted staff. With the Ramsey County East Building across the street, we have hundreds of impacted staff, not to mention residents, which I'll mention in a second. 257 staff attended a virtual town hall yesterday afternoon, which is a sign that people are looking for information. They're appreciating the opportunity to learn more, and we're doing all we can through written notifications, tiered and cascading notifications, but also this town hall, which is a really great tool for our team to pull together. On January 20th, the federal civil rights trial for 3 former Minneapolis officers is set to begin at the federal building and the U.S. courthouse downtown. Due to the risks of the continuity of county operations in the East Building, which is right across the street, and planned road closures, all the potential disruptions to the area, we are relocating the East Building Service Center and employees during this time period. Resident-facing services are moving to Metro Square, a few blocks away in downtown. Non-resident facing staff, the scan center and the mailroom are moving to the Plato office building across the river. It is a part, right? You all know where the Plato office building is. I won't describe that to you by specific block. Please expect that the relocation of staff and services will last 6 to 8 weeks, we're planning on, beginning on Tuesday, January 18th, so a week from today. There is fencing that's going up around the East Building. The courthouse already has fencing. The federal courthouse has fencing around it. Fencing is one of those things that's very difficult, and I want to acknowledge that. It's a visceral reminder of what is taking place in our community, the upheaval that it brings. It is not a step we take lightly. And it's one of those things that we look forward to being able to remove it as quickly as we possibly can at the conclusion of the trial. Safe Space, the shelter that has been operating across the street, will remain open. We have been able to ensure that we have plans in place that allow it to remain open throughout. Service continuity for those most vulnerable, regardless of the moment we're in, has been a priority. Thanks to everyone, both in our organization, with the City of St. Paul, with model cities, who have all been a part of ensuring that continuity through this process. A little more on the Downtown Service Center, that's Metro Square. It's going to be the second floor, Suite 2500, Project Remand, for any of you who have ever been a part of knowing where that existed in the past over in Metro. As I mentioned, the 18th, it'll be open 8 to 4:30, Monday through Friday. It'll include social services, family visitation, and a workforce services career lab. The building will be open to the public starting at 7:30 a.m. on those days. Staff will have badge access, and everything else will be taken care of. Parking for staff is available. We have 2-hour parking vouchers for residents that are available. In some ways, I actually think we've learned a lot the last few years as we have moved toward a voucher program at the East Building that's now applying here. That should be a takeaway for us that lasts long past any court trial as we continue our move forward. Communication began with the public on Monday. Signage is being installed at the East Building and in Metro Square. We're going to use our website like we did during COVID at certain moments of service changes as well. We're offering support. I'll end on this. We're also offering support to staff and community members, which includes reminding people about the self-care kit that's been a part and well received of our tools available to employees during COVID. We're also looking into adult mental health and how to ensure that we're connecting individually and in groups with individuals who are feeling pain or trauma, sadness, grief, or anything in between during the trial. The racial health equity administrators and the racial equity liaisons are working to bring in community consultants for some more circle conversations and spaces that exist for both staff and community during the trial. A lot of unknowns to come, but we've taken all the steps we can to mitigate them and ensure service continuity. If you have any questions, please let me know. This has taken the work of a lot of people during the holiday season, and my great gratitude and appreciation to all of them for ensuring that we remain residents first during a challenging moment. Thank you, Madam Chair.
Thank you very much. And we will move now to outside board and committee reports. So we are starting with Commissioner Ortega.
No report, Madam Chair.
Thank you. Commissioner Reinhardt?
The only report that I have is regarding some of the work around the issue of climate change and sharing the news of the initiative of really zeroing in on that through the Local Government Advisory Committee, through the National Climate Change Action Team, both of which I serve on for the National Association of Counties. Thank you.
Great, thank you. Commissioner Carter.
Thank you very much, Chair Maniscalco. I'd like to share that there is work taking place right now that has been in preparation in the past year and will be blossoming this coming year. The work I'm speaking of is the Bail Reform Initiative that has been building as a project of the Ramsey County Attorney's Office and the Ramsey County Sheriff's Office over the past year, with assistance from national and local organizations. Now that work is ready to move into a community visible phase. It has been engaging community all along, with co-chairs of the work being the county attorney and also community member Eliza Darris, who serves as a co-chair along with the county attorney. The work is now evolving so that, along with the national organization advancing pretrial policy and research, and with a local community engagement consulting, research and action, it is preparing for community sessions to occur in 2022. I wanted to raise the visibility here at the commissioner's table of the work that is in preparation. You will be hearing a lot more about it in coming months. The Bail Reform Working Group is meeting today, following a meeting of the executive committee on which I serve that met yesterday. The working group today will be talking about that process of community rollout for the purpose of engaging particularly those who are most impacted, people in our community, and the decisions that can be made at the booking step by our county attorney and our sheriff to explore alternatives to booking people into jail so that at the adult detention center, we will be able to carefully and creatively explore those alternatives and work with our community on supporting individuals who would otherwise have been jailed so that they are able to safely remain in the community and also return as necessary for any consequences that could result from having minor offenses. I just wanted to share that today, but also let you know that the work is being connected to community engagement and to communications at the county, centered at the county, so that we will see the common approach to our community forums and work to be done as we make these transformative decisions together with our community. Thank you so much for allowing me to share that.
Thank you, Commissioner Carter. Commissioner McDonough.
No report, Madam Chair.
Thank you. Commissioner McGuire. Oh, I'm sorry. I missed Commissioner Fretham. I didn't mean to. My screen. Thank you, Commissioner Fretham.
All right. I just have a brief update that I am excited to have been given the opportunity to serve as the secretary for the Metropolitan Mosquito Control Commission, which I've recently been appointed to and serve on with Commissioners Ortega and McDonough. So very exciting.
Congratulations, Commissioner McGuire.
Congratulations, Commissioner Fretham, on that honor. And that's a great commission to be on. And I've served on it for many years, and I was happy to give other people a turn, and so grateful that you're there. Madam Chair, I'm just going to give a few updates. I'm glad that the county manager mentioned the ice castles in New Brighton. That's a fun activity for all of our communities, and I haven't gone this year yet, but I went several years ago, and it was quite remarkable. So I encourage people to go to that, and thanks also to our park staff who have done a great job with that. Also, with my work at the Association of Minnesota Counties, the Big Four met on Friday, last Friday, which is the school boards association, the executive boards of the School Boards Association, the townships, the League of Minnesota Cities, and the Association of Minnesota Counties. We met Jim Showalter, the Commissioner of Management and Budget, spoke to us, and also we heard from Bill Doherty, who is talking about Braver Angels and how we can have fruitful conversations and bridge our divides. And I just want to say that the Big Four is very committed at all those levels of government to work together, to work with our legislators on things that we all need. And so it's a good meeting. We do it quarterly, and it's great to see that trying to come together on issues that we all care about. So was grateful to be a part of that meeting. Also, the NACO, our National Association of Counties, had our executive board meeting, and the big topic of conversation to that was on our upcoming legislative conference, which is still going to be in person, which we all are, wanting to make sure it's as safe as possible. Washington, D.C., as you all know, is requiring masking and proof of immunization, proof of vaccinations. And so we are debating how much we offer virtual options. At this point, it's very expensive to offer an entire hybrid meeting. We're hoping that we can live stream some of the speakers, and we're hoping that the voting will be able, and we're planning for the voting on our committees to be able to be done virtually as well. But they've experienced some reduction in people canceling their reservations, but they've also experienced an increase in people registering. I mean, some people canceled and more people and other people registered. So there's obviously some people are feeling more comfortable with the conference now that we're requiring masks and vaccinations, and others are not. So it's still in progress how that is going to look, but just know that at this point it's going to continue to be on, and there will be virtual options though for voting. So also some of you may have been on this, but there was a membership call, a NACO membership call that had the U.S. Treasury final rules for our American Rescue Plan dollars. This was a very exciting conclusion to a lot of work that NACO did in working with U.S. Treasury on making sure that counties got direct allocations on these ARPA dollars. And so this is the final rules on how that is going to be allocated. And we're grateful that counties are getting as many direct dollars as we are. So if you want to listen to that, that's actually on the NACO website. My last comment is on the Ramsey County League of Local Government is going to have their legislative meeting, not this Friday, but next Friday. So I just wanted to make sure it was on people's radar. It's January 21st. Legislators will be invited, as of course all of our cities and our school districts. I think it's a great meeting for as many of us to be on as possible. We're going to be presenting legislative issues that we all can work on together, and we'll hear from our legislators. So Ramsey County League of Local Governments, January 21st, 7:30 to 9. And also on that day, the AMC Board of Directors will be meeting at 10. So thank you, Madam Chair.
Thank you very much. So just a couple quick updates from me. I wanted to share that our staff have now been trained on the mapping tools for redistricting. So they're playing with those maps. The strategic team, the team that's been hired to do consulting around redistricting is on board and will be reaching out to your offices for meetings to hear concerns as well. And then the last thing I just want to share, like Commissioner Fretham, I was voted into a new role and am now chairing the Great River Rail Commission, which, as you know, was the originally TCMC second train. But I also wanted to share that we've gone in consultation with Commissioner Ortega, kind of thinking about a regional collaborative on what that looks like and growing more partners. We actually had our meeting this week with the largest turnout ever, and had a whole bunch of interlopers from Wisconsin join our meeting because Wisconsin is doing really deep investment into passenger rail, and they have support for additional trains coming in and out of the Twin Cities through Wisconsin. So more to come on Great River Rail, but passenger rail, as we know, aligns with climate goals and reduction of carbon as well, and really thinking about how do we make that passenger rail align with our other transportation, transit, and light rail initiatives throughout the region to bring a collective together. So with that, we will adjourn this meeting and move to an HR meeting that Chair McDonough will lead. We'll take a 2-minute break so staff can reset, and if you need to take a quick sprint to the restroom. And then this afternoon at 1:30, we'll have a workshop led by Commissioner Fretham on min choices and financial services. So we'll pause now for a 2-minute break and adjourn this meeting.